We have complete coverage tonight on the announcement that Virginia will soon be getting nearly 500,000 doses of coronavirus vaccine. That's an increase from the 70,000 expected vaccine doses we told you about yesterday.
First, we're going to go to our Matthew FULTZ, who has public reaction to this news and details on who will get the vaccine first. Matthew?
Well, yeah, Bill and Candace, most of those Richmond residents that we spoke with tonight say that they're kind of happy that the vaccine is coming now and that they say they would take it when it's available for everyone.
It's been a scary year, actually. A lot has gone on.
There are just a few weeks left in 2020, a year that's forced many Americans to stay home and mask up.
I'm in my house all day and I'm working. I get out and I go for a swim, but it's been taxing on me.
While working from home has become a new normal for Darrell Robinson, going to school online has become routine for students.
I'm in school, so it's pretty hard. I hate online school.
But those two things may end soon. The Virginia Department of Health announced Friday the state is preparing to receive 480,000 doses of the vaccine by the end of December. That's an increase from the 70,000 expected vaccines we told you about earlier this week. VDH says the two manufacturers will be Pfizer and Moderna, and that healthcare workers and long-term care facility residents would be the first to get the first doses. Healthcare workers that care directly for COVID-19 patients would get top priority over other healthcare workers. Those we spoke with in Richmond Friday evening say they would take the vaccine when it becomes available for everyone.
Oh yeah, absolutely, I would. I would take it, yes. I hope everyone takes it because I want this to end. We want it to end. So yeah, for sure.
I get my flu shot and everything. Like, I don't get why not. It's not gonna hurt anything. I don't think so.
Now, the first shipment of that FULTZ is expected to arrive in mid-December, with all other doses arriving by the end of December. Working for you tonight here in Richmond, I'm Matthew FULTZ, CBS 6 News.
Thanks, Matthew. Some local healthcare workers say they're relieved, yet still on guard tonight as word spreads that Virginia will receive enough vaccine doses for almost every provider. Our BREE SISON spoke to a nurse with Richmond and Henrico's Health District about what it means for them. BREE?
Well, Bill, if this were a football game, you could say that the end zone is within reach, right? But healthcare workers say the next few weeks are going to be critical to getting everyone into that end zone, right? So the CDC's recommendation to give vaccines to healthcare personnel first is intended to ensure that the country continues to be able to take care of others who become ill. Even if every healthcare worker in our state receives both doses of a COVID vaccine by the end of the month, it still will take several weeks before they're considered inoculated. That means we still have more than a month to go before anyone is considered safe.
There is a light at the end of the tunnel, but we are still in the tunnel. So we do, even as healthcare workers, even after getting vaccinated, we'll need to wear masks and social distance and stay home when we need to for several more months to come.
Over the course of the pandemic, hundreds of thousands of doctors, nurses, and healthcare providers nationwide have become infected, with more than 850 of them dying from this infection. The concern is if we let our guard down and lay off the gas on things like social distancing and having more people over at Christmas, well, that could put more people at risk during this potential winter surge. Working for you, BREE SISON, CBS 6 News.